Awesome. Well, good evening, everyone. Welcome back to the second virtual Palm Beach International Equestrian Center educational series presented by Adequan here at the Winter Equestrian Festival for week 2. My name is Miranda Tiona, and I am happy to return for the 2021 season as the educational series coordinator. I am delighted to virtually spend the remaining 11 weeks that we have together with you every Thursday at 6 p.m. Eastern Standard Time to learn. We had an exceptional turnout last week for WEF Week 1 with 7 countries represented over 4 different continents and with viewers joining from all over the continental United States. So thank you all so much for your participation, and we are very glad to continue virtually during these COVID-19 pandemic times. For those who were not able to join last week, I will briefly go through some functionality so you know how to engage with us virtually. So if you have any questions for the speakers at all, please utilize the Q&A message center that's at the bottom of your screen. It's a small little icon. We will save the questions to the end, but you can type in your questions at any time that you want. And both myself and the speakers will have access to that and we'll be able to answer them all, like I said, at the end. We'll also be running an interactive poll during the series today to help gauge the audience. So please look out for that and we encourage your participation. Lastly, I would like to say a huge thank you to Karina Brez Jewelry for providing a luxury item, being a limited edition light pink diamond 18 karat rose gold horseshoe necklace valued at $3,000 for the grand prize giveaway. For every session that you attend, which we can see the statistics if you attended or not, you get 1 entry. The winner will be announced on April 1st, and you don't have to be present on the webinar to win. We will reach out to you via the email that you registered with, so hopefully you check that. Now, with all that said, let's begin. I am delighted to introduce today's topic and speakers. Today's educational series session is sponsored by the Palm Beach Equine Clinic, and the topic is tips for maintaining overall equine health and longevity. We have 4 excellent speakers lined up for you today. I'm sorry, 3 speakers lined up for you today. Our first speaker is Dr. Ryan Lukens, who was raised on a 30-acre horse farm in Ohio. He obtained his doctorate in veterinary medicine from Ohio State University, where he also played on the football team as a fullback and linebacker. He is a 4th generation veterinarian, but he could also be a vegetarian, and is a certified veterinarian medical manipulation practitioner. Dr. Lukens primarily focuses on equine sports medicine, lameness, and chiropractic manipulation. Our second speaker for you today is Dr. Marilyn Connor. She completed her undergraduate degree in biomedical science with minors in chemistry and business from Texas A&M University. Before obtaining her doctorate in veterinary medicine, she worked in New York City as an analyst and junior stock trader. She is an integral part of the Viceromos Therapeutic Riding Center, a PATH certified therapeutic riding instructor, and a veterinarian ambassador for Horses Healing Hearts. Dr. Connor is a certified veterinary chiropractor, and treats a broad range of cases, including sports medicine, nutrition, lameness, wound management, and alternative therapies. Lastly, our last speaker will be Dr. Tyler Davis, who is originally from a farming area of Pennsylvania and earned his veterinarian degree from the University of Glasgow in Scotland. He is a member of the Royal College of Veterinary Surgeons and treats a wide variety of equine cases. Dr. Davis primarily focuses on equine dentistry, which encompasses the objectives of maintaining even tooth wear, treating infections and disease, ensuring proper digestion, and promoting longevity. So, with that said, I would like to turn it over to our first speaker, Dr. Ryan Lukens, to take it away. And don't forget to mute yourself. Thank you so much.
Hello, this is Dr. Ryan Lukens. I hope everyone can hear me okay. Welcome. Thank you for attending safely from home. The team at Palm Beach Equine Clinic hopes you enjoy this interactive learning experience. And as Miranda said, we will take questions throughout, but we will answer them at the end, please. Miranda already introduced myself, but I want to make clear I'm not a vegetarian. I do like to eat everything. So that pretty much sums up here. In 2017, I started to specialize in chiropractic adjustments. We'll get into that here. I'm not technically a chiropractor. So a chiropractor is a human term. We need to call ourselves a medical manipulation practitioner. It gets a little bit confusing like that, but technically I'm a CVMMP and not a chiropractor. And to get more confusing, I perform equine veterinary medical manipulations, so EVMM. And all that means, and I might refer to it as medical manipulations throughout this presentation, but I can also say chiropractor just so we don't confuse people. And that's just not, I just can't put that on my business card. But so what is veterinary chiropractic? It's the art of improving motion at segmental levels. This includes bones and the supporting soft tissue structures and nerves. The way I know where to make these adjustments is what is called motion palpation. And I'm looking for hypomobility, which is a decrease in motion. So the goal of medical manipulation is to create free movement throughout the body. The main way we do that is restoring range of motion. And by restoring range of motion, it helps to relieve pain, enhance performance, and greatly reduce compensation. And when horses start to compensate, that's when they most likely hurt themselves. So we're reducing chance for injury. Regular adjustments on horses help maintain their natural balance. And also, horses have a very high level of proprioception, which is basically their perception of position and balance. So how do we perform these manipulations? There's 3 different areas where a horse can take a part of their body. The normal range of motion, which they can do on their own. Then it goes to the passive range of motion, which you can do to your own horse by stretching, extended hold stretches. And I take the area that I want to manipulate beyond the passive range of motion into an area called the paraphysiological space. And this is called the setup, or bringing the area to tension. This space is referred to as an elastic barrier of resistance. And a horse can be injured in this space if not handled appropriately. So when the area that's needed adjustment is in this space, I perform what's called an HVLA. So basically it's a very fast, very short movement. HVLA is high velocity, low amplitude. And this is the act of the adjustment on the patient. My instructor at the Chi Institute in Ocala, Florida, used to, or still does, refer to it as a sneeze thrust. So just like a very quick, short burst. So we hear a lot of things when you talk about chiropractic stuff. First of all, the name, which is a little bit for humans, but also you hear subluxation. And that's a little bit of a misnomer. A subluxation you can see right here on the pasture joint, and you can see it on radiographs. What I fix, you cannot see a change on radiographs. This horse needs a lot more help than I can do with just my hands. I'd probably send him downstairs to the surgeon. So I don't fix subluxations in that term. I'm fixing restrictions of movement. You also hear that cracking of the neck is very harmful. It can be, but most of the time this cracking noise that you're hearing is just a displacement of synovial gas when I make the segment move appropriately again. So that's not necessarily a bad thing. It just means that a good adjustment was made. I also hear a lot that, doc, I need your help. The horse's rib is out. Well, I know what everybody means. The rib's not out. It's not subluxated. It's just not moving appropriately, and it's causing adjacent sections to be hypermodal. So ribs can be very painful when they're out, but it's because they're not moving and the segments around them are moving too much. And when the segments around move too much, that's what causes the pain. So adjusting ribs can be a little bit tricky because horses can resent that. Also, sternum can be stuck. That's just something I hear all the time, and that's just also a decreased range of motion. So why choose a veterinarian to do your chiropractic work when you can use a human chiropractor that's trained in working on horses? I think anatomy is the key here. You know, we spend our whole lives learning and working on horses, and we should know anatomy like the back of our hand. So I think having a good knowledge and base of that is very important. You know, the key is to not harm the horse. You can harm a horse with doing medical manipulations, and that is against our oath as veterinarians. So we have to be careful. Also, it's good to check for dental health, and which we'll talk about later in this learning experience. And you need to have properly shod horse, because if you have a bad mouth and the horse hasn't been trimmed in 8 weeks, then the benefits of these adjustments are not going to be as great, and they're not going to last as long. So also a vet can decide when not to adjust. If a horse is showing neurologic symptoms, I will take neck x-rays before I put another hand on them as far as making an adjustment. I always ask the rider if there's any concern about previous trauma or neurologic symptoms. The question that should be asked is, does the horse know where his feet are at all times? If the answer is yes, then we can move on, and I can further assess if there's any proprioceptive deficits. So if ataxia is suspected, you don't want to do an adjustment. Ataxia is not walking with coordination, stumbling or tripping, for example. And I actually screen for ataxia before every adjustment by starting with an evaluation at the walk. So that's very important. We'll do some brief anatomy slides here. Basically, there's over 50 bones that make up the vertebral column, which is just the top line from neck to tail. Once again, the thoracic and lumbar vertebrae alone contain over 250 joint surfaces. So there's a lot of places that can be not moving in their normal range of motion, just under the saddle and just behind it. You see restrictions, but you don't see changes on the radiographs. That's just another example there. Another quick anatomy point here. The top of the thoracic vertebrae is pointing backwards, and that's resisting the pull of the nuchal ligament. And then the opposite is true with the lumbar vertebrae. They actually slant towards the head to counter the pull of the lumbosacral junction and to counter the pelvic rotation. Moving on to the ribs. Horses have 18 ribs. The first 8 are connected to the sternum and are called true ribs. These true ribs make a very stable structure, and they all work together. If one part isn't moving appropriately, the entire structure is affected, and that's why this can be painful. There's a lot of interconnection between the sternum, the true ribs, and all the soft tissue and nerves. Here's a picture of some of the nerves you see that are associated with the ribs. There's a whole network there, and pressure can be put on this from the saddle and the rider, which can lead to nerve dysfunction and muscle atrophy. Also, the girth puts pressure on all these muscle groups you can see right here, which indirectly affects the nerves in this area. So here's a picture of the nerves in this area, and there's a lot of important ones. We need these nerves to be firing appropriately, is what we call it, and because when they fire, they help the muscles grow and thrive. And if the muscles are dormant and not firing and not being activated, the muscles will atrophy. And so adjustments help activate these nerves and help them fire when the horse isn't working, and help to feed the muscles in this area that are being compromised by pressure from the saddle and rider. In a little bit of review, restrictions cause a loss of range of motion while the joints still remain intact. Restrictions often cause horses to compensate, which can injure other areas of the body. So motion segments around these restrictions move too much, and these surrounding segments can be injured both inside and outside the normal range of motion. Another important thing that medical manipulation helps is the autonomic nervous system. Adjustments can help balance this autonomic nervous system by promoting the parasympathetic portion. I'm sure a lot of you have heard of fight or flight, which is nature of the horse. And this is the sympathetic nervous system. And the opposite of that is the parasympathetic. It's rest and digest. And regular manipulations give the body experience to resist major and sudden changes to this autonomic nervous system. When you get sudden changes in this nervous system, the sympathetic fight or flight response comes on, and it can cause erratic behavior. So who benefits from manipulations? It's not just the Grand Prix horses. It can help everyone, from minis to the Grand Prix horses. Adjustments, like I said, help calm the fight or flight system, and this helps improve overall health by neutralizing stomach acids, lowering blood pressure, lowering cortisol, which is important in Cushing's, and it also helps to strengthen the immune system. Even horses that are getting rehab will benefit from adjustments, because the manipulations help to reset the muscles to a resting state by firing the nerves that are associated with it. Here's a quick case that was very much helped by medical manipulations. This is a 9-year-old Dutch warmblood used for dressage. It was training 3rd level, and it was given to a new trainer to prepare it for sale. When the new trainer received it, it was about 300 pounds overweight, and you were unable to put a fly mask on it. It was very head shy. It presented with right front limb lameness and stiffness on the lunge when traveling left. You can see in this picture it had atrophy of the paracervical muscles right through the middle of this picture here. You're seeing lots of cavitation in the muscling. Right through here, see these divots in the neck. That's not normal. You see it quite often, but that's a very good sign that the nerves aren't firing correctly there, and the muscles are suffering. So the horse could need an adjustment. So I found restrictions at the left pole and C5, 6, and 7 on the left side. So whole lower neck on the left side, and then C6 on the right side. The horse was responsive to the adjustments and more tolerable to having hands around the face and ears after these adjustments. Here's a picture 4 weeks later after just 2 adjustments. The paracervical muscles are a little bit more filled in. It's only been a month, but there's definitely some improvement there. Seen on the left side, this is before the adjustments, and when the horse just arrives, you see a lot of cavitation here and loss of muscle, and this is the more remarkable side. Look how much better that looks. That's very convex now. That would fill your hand if you slid your hand down that neck, and that's what you want. You want muscles to be convex and fill your hand, and that means they're healthy and you're not seeing cavitation throughout here. and indents. So this horse benefited a lot from just 2 adjustments over 4 weeks. And honestly, I only adjusted, I wanted to see how I could help this horse with just adjusting the neck. And I just adjusted the neck twice over 4 weeks. And this is the difference it made. And it lost about 100 pounds of fat with its training as well. And the right front lameness improved 1 degree with no other treatments except for medical manipulation. So final thoughts, medical manipulation helps to restore normal range of motion, and it can decrease pain and chance of injury. It's beneficial for gut health and overall immunity. It's a safe treatment if performed by the correct person under the correct circumstances. And it can be used in conjunction, I use it all the time, with traditional joint therapy. So I just wanted to thank my father, who was a vet and taught me everything. And Ohio State, I was there for 8 years, and my colleagues and team here at Palm Beach Equine Clinic, and my instructor, Carla Pastor, at the Chi Institute. Thank you very much.
Okay. Hi, everyone. I am Dr. Marilyn Connor, and I'm going to start my presentation now. Give me a second. Technology, gotta love it. Okay, so here we are. Now we're at my title slide. So my presentation covers a very broad, wide-ranging subject that is near and dear to all of our hearts, and oftentimes the source of fear and terror for equestrians. So I wanted to demystify a little bit of this and talk about equine sports medicine and lameness, and specifically how you can incorporate it as part of your training and your competition strategy to give yourself the competitive edge and keep your horse healthy, happy, sound, and for as long as possible. So first off, who am I and what experience do I have that might be useful to you and help you as an equestrian? So I was born and raised in Texas, and I started off as a fairly typical horse crazy girl. I have ridden horses in every discipline you could imagine, ranging from Western pleasure, hunters, then jumpers, dressage, and my most recent competitive endeavor is competitive endurance racing, which is over here on the left. So that's my personal side. And before going to vet school, in addition to the experience I had on finance, working in New York City on Wall Street, I actually did many different roles in the equestrian industry. I put the word professional in quotes because I wouldn't necessarily say I was like a rock star at any of these things, but I have held some of these roles in all these different areas, including teaching lessons for children. I ran an equestrian and small animal rescue program. I became certified in therapeutic horseback riding, where I taught children and adults with disabilities ranging from mental to physical, how to ride horses and use that as a therapeutic horseback riding instructor, as a therapeutic modality. So I tell all this to you not to brag about me, but just so you understand, I get it. I get what you're feeling when your horse isn't feeling right and how stressful that can be. So after all those other jobs I had, I decided I really wanted to take the plunge, and I crossed over to the other side. I went back to school, back to Texas A&M University, where I pursued my doctorate of veterinary medicine degree from Texas A&M University. After I graduated from vet school, I moved to Wellington, Florida, and I have been practicing here ever since. I am primarily based in Wellington in the winter for the show season. In the summertime, I am lucky enough to travel around to follow some of these cool horse shows or events, places like Wyoming, Miami Beach, Tryon, North Carolina, New York City, to name a few. So sports medicine. Sports medicine is a big term, and at its basics, we talk about sports medicine as the goal as treating and preventing injuries as they pertain to the athletic endeavor of sports. Horses have evolved over the years, but at the end, they are athletes, and we have to value them and prioritize them as an athletic portion of our competition equation and treat them such. So, equine sports medicine, how most people think about it. Most people think about equine sports medicine as lameness, lameness, and lameness, with two sides being treating lameness and preventing lameness. So what is lameness? Lame. I put this as a joke. It's the dreaded four-lettered word of the equestrian vocabulary, you know, like, oh my gosh, my horse is lame, it's the end of the world. So it's important to remember that lameness is a very common thing. It's often treatable. Sometimes it's not treatable, but that's, you know, my job as a vet or any other vet in our team's job to help you kind of understand that. But lameness is the most common cause of loss of use in the horses. It is a symptom of a problem. It's not a disease in and of itself, but it's a symptom of disease. Lameness is by definition an abnormality of gait or stance, and lameness can range from very subtle performance-related issues to all the way to severe problems that are obvious to even a non-horse person. So what causes lameness? I put some pictures that, you know, I think anyone, even a non-horse person, could tell that these would probably cause your horse to experience lameness or pain. These are trauma. Trauma is an obvious cause of lameness. It's pretty straightforward. Treatment may not be straightforward, but you know, it's pretty explainable as to why this horse is not going to feel good tomorrow on the left. This horse on the right is probably not going to be feeling good, and he needs to call Dr. Lukens. And this horse in the center will probably need to call Dr. Tyler Davis because he inevitably has fractured a tooth somewhere. So these are some obvious causes of lameness, but they're not the most common cause of lameness. Usually lameness starts here. These two pictures look like two beautiful horses doing their job the best they can, and that is exactly what they're doing. But that is oftentimes how lameness starts. It starts as a repetitive overuse type injury. And that could be something that's subtle and builds up over time, or it could be a single misstep that happens in the arena that is an acute onset of lameness. So this is the more common, but not always the most obvious source of lameness. So let's go back to lameness again. Lameness is not a disease. It's usually, not always, a sign of pain. So I put this cartoon here because this, you know, this would make my whole life easier if this was actually how horses work. At the bottom, you probably can't read it, but what it says, what hurts? Your foot? Question mark. No, wait, don't tell me. Let me guess. And I feel like sometimes as horse owners, that's, you know, what we end up having to do is we just look at our horse and we're trying to use all our best judgment and skills to try to understand, but sometimes ultimately you're making an educated guess, which can, if it's correct, be fine, but if it's incorrect, have sometimes catastrophic consequences. So in an ideal world, horses could talk, or maybe that wouldn't be ideal, I'm not sure, because my horse may not have nice things to say about me, but why lameness is hard is because horses instinctively hide their pain. It's important to remember that they've evolved in the wild as animals of prey, meaning that they are hunted by other animals as a source of food. Over here on the right, you can see these wolves that are chasing this horse. Predators, or the animals of prey, they will look at a herd of animals and select out the easiest target. So if you are a horse in the wild, you are instinctively programmed genetically to try to hide your pain so that you are not the easy target for that wolf over there, if that makes sense. And interestingly enough, because horses are so good at hiding their pain, a recent study that was published in the Horse magazine found that in a survey of riders who identified their horses as sound, 73% of those horses had some evidence of lameness at some point in an examination subsequent to that. So that's really funny, you know, you think your horse is sound and there's actually 73% of them had some teeny tiny or maybe major cause of lameness. So lameness back as pain. So there's common lameness and there's uncommon lameness. Most common sources of lameness go around pain. And I broke it down into three major categories, but far and away, the biggest of these three categories is the hoof. 60% of the horse's body weight is carried by the front legs. Of lamenesses that originate in the front legs, approximately 80% of those involve the hoof or structures within the hoof capsule. So, most common source of lameness. And the second two groupings would be degenerative joint disease over here at the top, illustrating a healthy joint on the left and an inflamed joint on the right. Those are things like osteoarthritis, developmental joint disease, synovitis, capsulitis. Then down at the bottom, talking about soft tissue injuries, such as tendon and ligament injuries, things such as the superficial or deep digital flexor injury, the suspensory injury, and soft tissue injuries are often some of the most frustrating and challenging to diagnose, take the longest recovery time, to fully get back into performance. So I have this cartoon here because, again, I like to incorporate humor. Everyone's an expert, right? Like if you ask 10 people what's wrong with a horse, you're probably going to get 10 different opinions. This cartoon here, the horse is saying, I'm actually fine, but the people think it's the right front, he's off in the back, it's the front left. Regardless of if this horse is lame or not, it's important for us to remember that lameness is usually secondary to pain. Finding the source of that pain is what gets tricky. Different diagnoses will often have dramatically different treatment outcomes and long-term outcome for the horse. Making assumptions, as we've all heard the old adage, can get you into trouble. And so by assuming you understand what's wrong with your horse and treating it based on your assumption, you may ultimately cause long-term problems for your horse. So beyond the obvious signs of pain that are orthopedic, musculoskeletal, there are other causes of lameness that I just want to briefly mention. It's beyond the scope of tonight's discussion, but frustrating lamenesses can often evolve into things that pertain to saddle fit issues, metabolic problems, such as this horse on the lower left. He might suffer from a metabolic issue called HYPP. Dr. Peter Heidman here is performing a muscle biopsy to confirm that in this horse. Neurologic problems can be a source of lameness, as shown by the gray horse having its tail pulled. Infections such as cellulitis can be profoundly painful and cause a sudden onset of lameness. Digestive issues such as ulcers can be a source of subtle lameness, and respiratory problems such as recurrent airway obstruction, also known as heaves, exercise-induced pulmonary hemorrhage, upper airway dysfunction, and more. So, equine sports. Let's talk about sports medicine again. We're looking at this as a sport. It's a highly competitive sport. It's actually a billion-dollar industry now. Globally, equine sports are estimated to contribute 300 billion, yes, billion with an E, to the global economy. Billion with a B. Billion with the B to the global economy. So just like any sport, you need a sports strategy. It's important to develop an offensive strategy who's staying at the top of your game and keeping your horse at peak performance for a long and successful career. Decent defense, which is something that's helpful in sports, is often too late when it comes to horses, and you'll end up wasting a lot of time, money, having a lot of heartache and frustration. So remember my original Venn diagram that showed lameness and sports medicine and having it being treating injury and preventing injury? This is how I think equine sports medicine should be looked at. Instead of it being equally focused or maybe even predominantly focused on treating injury on the right here, I think our focus as practitioners and as equine professionals should be on preventing injury. Treating injury is always going to be part of the equation. If there was a way that we could prevent it, then I'd be out of a job, but you know, prevention is key to me. So I'm going to tell you a little one of my life hack secrets. It's going to go on the internet now, so everyone's going to know it. Called the 5 Ps. Proper prevention prevents poor performance. So that'd be great if that was actually always true. We can't always prevent poor performance. So I added in my little caveat, most poor performance. Proactive prevention centers around the following 4 words. Prevent what you can, catch things as they come up, early detection, treat things as they come up, and then repeat, you know, go on, carry on with your life, enjoy your horse, and then keep doing your thing. So preparation starts at home. Just like anything, like if you're building a house, you have to start with a good foundation. And that good foundation is built at home. You know, as a veterinarian, I'm here to help you with the whole process, but a lot of the work has to be done on your own. So things like proper training, which includes adequate rest, high quality nutrition, including high quality forage and grain products that are appropriately selected for your horse and his individual metabolic needs, as well as correct and balanced farrier work. These are all crucial to keeping your horse performing at its best and essential to trying to prevent causes of lameness that are preventable. Another thing that people commonly ask about are supplements, and there are 1,000,001 supplements on the market, and a lot of them are wonderful, a lot of them may not be so wonderful, and it's difficult to tell the difference between those. Supplements aren't as heavily regulated as standard pharmaceuticals. So as a veterinarian, that's something that I provide guidance and assistance to my clients on selecting the best supplement protocol for their horse to give them optimal success. I just featured 2 products that I commonly recommend for horses because they are relatively benign, meaning non-harmful in nature, but have widespread systemic benefits. So one is Adequan. It's a chondroprotective, meaning it protects the joint. And another one is a nutritional product that I personally like a lot because I have a lot of familiarity with it. Does not mean it's the only product on the market that does this job, but is Platinum Performance. So they provide excellent oral nutritional supplements that can help your horse perform at its best. So other modalities that we use to help keep your horse performing at its best are using some alternative techniques, such as chiropractic medical manipulation that Dr. Lukens mentioned before. That's an excellent strategy to keeping your horse healthy, fit, and sound. Other things that we implement are something known as therapeutic laser. It's a laser that helps regenerate tissue and collagen. In the middle is electroacupuncture, which is something that I have started incorporating into my practice. I also went to the Chi Institute like Dr. Lukens. Instead, I studied acupuncture. That's the use of Chinese medicine to help the body to stimulate healing and reduce pain. As well as on the right over here, this is something called shockwave therapy, and we use that to stimulate healing as well as decrease pain and inflammation. So lameness is best if you catch it early. I include this slide here, and I'm not going to read it all to you guys, but it's part of this PowerPoint presentation for you to refer back to. But the main thing, like any health problem, is know your horse. Know what's normal for your horse. Keep your hands on your horse often. Look for subtle changes, and if those subtle changes stay consistently there, that might be the time that you need to call the vet out. And when in doubt, call the vet. That's our job. That's our area of expertise. That's why we went to 10,000 years of school. So let us help you. So planning ahead for success, the performance evaluation. This right here is a picture of a performance evaluation. I'm just going to briefly go through some of the different aspects of it. It involves examining the horse, watching the horse move, as well as performing flexion testing. If we find a problem, we may dig a little deeper and do some diagnostic imaging, such as right here, this is Dr. Davinsky at our practice performing an ultrasound, and Dr. Santiago Demir and myself performing x-rays. These are some examples of some of the modalities that our hospital offers. Some of these are traditional and offered at most hospitals. Some of them are a little more complex and only offered at human hospitals. Nuclear scintigraphy, also known as the bone scan, the CT, and MRI are some things that are unique to Palm Beach Equine Clinic that very few equine practices have the ability to offer. Traditional treatment options when you do have lameness, these are probably things that you guys have heard about a million times before. Rest, ice, anti-inflammatories, joint injections, whether that's traditional or alternative medicine such as biologic-derived products, and ultimately surgery. These are all things that we can offer to help you as your horse to get back to recovery. The tools that I mentioned before, these alternative therapies, they can also be useful in enhancing your healing of the horse to speed up that time, as well as increase the integrity of the structural material when it heals. Collagen doesn't heal as well, or is not as strong when it's healed as the original initial collagen that you're made when you're born. So some of these alternative modalities can be helpful in causing increased structural integrity during that healing process. And then finally, this is that same slide you saw before, but we're more or less repeating the same process. That performance or lameness evaluation would then be repeated and rechecking your horse to evaluate that he or she is sound and suitable to go back into training. So ultimately, the goals of equine sports medicine and lameness are to help you to enjoy your horse and get back in the game. We want to help you prolong and enhance the athletic career of your horse, safely stay at the top of your sport. Using advanced and early detection problems, we can catch small, subtle abnormalities before they become a big, full-blown injury and help you return your horse to work and competition and doing what you love. Thank you very much for your time, and I will turn it over to Dr. Davis.
All right, so I've already been introduced, but let me go briefly. My presentation today, as mentioned previously, is on equine dentistry, and basically this is going to start with we're going to keep it pretty basic, and so that we can talk about some things that are going to be beneficial to horse owners and how to keep you guys happy and your horses happy. So again, Tyler Davis, originally from Pennsylvania. As mentioned previously, I did my undergraduate at Penn State, and I studied at the University of Glasgow in Scotland for vet school. I completed an internship here in 2010 and then been in the Palm Beach Equine Clinic since then. My wife also is a veterinarian at the practice, and I have two daughters, Zella and Maisie, who are into horses themselves and probably spend enough time here to be honorary veterinarians. So let's get into the presentation. So why is dentistry an important part of horse management? So let's go down this pathway here. So let's start with digestion. Digestion is, the very beginning of the lips, the mouth, and teeth are the very beginning of the alimentary canal. So this is where we prehend food. The horses are chewing and processing, that food material from the very beginning. So with improved digestion, you can have improved utilization of the food that's consumed by them. And then this kind of goes in a stepwise fashion. With improved digestion, you can have improved health and fitness. With the appropriate dental work being done and the horses having good dentition, they're going to digest their food better, and then going to be able to utilize that food better and use it for things like muscle production, improving their body condition score, and converting that food into energy that they're using to do their work. So this kind of highlights that, better dentition, better digestion, improved health and fitness. And I think rather than say increased performance here, it should probably just say performance. And we'll go into that a little bit more in a second. So, what I mean by that is that with performance, what we're actively doing with dentistry is we're not necessarily improving the performance as much as we're trying to keep your horse at that top level of performance. So by routinely doing the dentistry, we're looking at keeping that horse at a level where it's not complaining and it's happy and it's doing its job. Now, where you can come into an issue where you increase performance is if that horse has an issue. In that case, certainly by correcting that issue, we can in fact improve performance. So, as far as the health and fitness of the horse, the other side of the performance that's pretty directly related to dentistry is the comfort of the bit in the horse's mouth and the connection between the horse and the rider, which is very important, both of which we can greatly affect through dentistry. And then the last thing is, horses' life expectancy. Over the years, with better dental practices, better food materials, we can greatly increase the life expectancy of horses compared to what it once was. So to go into just some brief anatomy here, and I'll try to point out a few of these things with the laser pointer, but this is just the basic anatomy of the teeth. And so equine teeth are hypsodont teeth, which means they're a long crowned tooth. And here, so this is the portion, and this is the gum line. So this is the only portion here that's present in the mouth that you can see when you open a horse's mouth. But all the rest of this is the reserve crown. This is also covered by enamel. So in our mouths, we have brachydont teeth, which means short crown. So all the exposed tooth that you see in your own mouth is the enamel covered portion, and then it narrows down to a neck, and then there's the root. So because horses, these teeth are designed to wear down, 4 to 5 millimeters every year as they grind food. So that's why they're designed the way they are. So if we look over here, the way that's able to happen is because, like human teeth, they do have enamel, but in a human tooth, you have your entire tooth covered with enamel. If you have a defect here in horses, they have not only enamel, which is the hardest portion of the tooth, but they have cementum, which is softer, and then they have another product called dentin that's here, and you see the pulp cavity going down through the center. So as a horse grinds its food, it grinds some of this tooth and it wears down. The enamel, being the hardest part of the tooth, is what's left behind in the way of like sharp points, whereas the cement, and so over time that cementum, you know, kind of more is laid down through this pulp cavity, and it hardens and, you know, prepares that surface for further grinding. Let's go to the next slide. So again, this is just the skull. You know, here is the mandible, the maxilla up here. If you're looking through, horses have their incisors up here, canine teeth, and then mainly these are the cheek teeth. The premolars and molars are what we're mainly concerned with when we're floating teeth. But it's also important to recognize issues with these incisors too, because their bite here can affect what goes on or how these teeth wear and vice versa. So the incisors are kind of more designed to cut the food, you know, when they're grazing, they cut the grass off. And then as you imagine, these large teeth back here are the ones that are grinding the food up. So, and then the only thing that this horse does not have, or maybe it would have, but we can't see, is wolf teeth, which are actually a small first premolar. And obviously that's something that we are concerned about in dentistry as well. So another thing to kind of consider as a horse owner is, you know, whether you have a young horse or an old horse, having tooth eruption. So horses have two sets of teeth. They have a deciduous set, which is like, you know, baby teeth. And then they lose those and have a permanent set. And then as we were kind of mentioning, because of the anatomy of the teeth, these teeth wear over their lifespan and kind of erupt as they age, and will grind over time or wear over time, but continue to erupt. So they always have a chewing surface until they're, you know, older, and then we run into some other issues. So briefly, I'm not going to talk a lot about this, but this is kind of within, you know, foals, you know, they get their first tooth within 6 days, and then second tooth 6 weeks, and third tooth about 6 months on the incisors. And you can kind of, you know, age teeth that way. But more importantly, just looking at this slide here on this right-hand side, is that if you look at between, you know, 1 year and about 5 years of age, all of these permanent teeth are erupting in the horse's mouth. So that first 5 years of time, there's a lot of changes going on. And so part of us recognizing and understanding some of this dental stuff is so that, you know, as we recognize issues, we can realize that it is an issue and call a veterinarian and get us out there to help you out. So some things that, you know, would be common to recognize was tilting or tossing of the head while the horse chews, wringing of the neck, or of the tongue, I'm sorry, unable to chew carrots, or, you know, changing their behavior in the way they chew, and then increased or excessive salivation. So these are all things that are, you know, could be explaining simple issues that we could fix, or could be slightly more complicated. More things to look at here is, you know, not finishing their hay or grain, quitting, which is what you see here on the right hand side. That picture is a horse quitting, where it's chewed its hay up, it's balled out, and now dropping back out of its mouth. And then poor body condition. Obviously, if your horse is not able to utilize that food and it's not chewing correctly, it's not going. All right, everyone, I apologize. Not entirely sure what happened, but hey, we're dealing with technology here. So I apologize again. I don't know where I left off or where you stopped hearing what I was saying. So I'm going to start here, and I apologize if any of this is redundant. So we're going back to recognizing dental issues, and right here in the picture to the right is a horse that's quitting. But this is, you know, horses that are not finishing their hay, they're quitting or packing their cheeks with food. Obviously, poor body condition, is gonna point us towards poor dentition, undigested hay in the feces, and then discomfort or abnormal behavior when eating or chewing. More of these are not related to the actual chewing or, you know, watching your horse eat, as much as it is just things that you would see every day. You know, is there any swelling in the face or jaw? Does the horse have nasal discharge? Is there odor from the mouth or nostrils? Blood from the mouth? And then, on a basis of when the horse is being ridden, are they chewing the bit, resisting contact? Again, head tilting or tossing, rearing, or not turning or stopping, or, you know, doing what you're asking of them. Some of these are just illustrating that. You have blood from the mouth here. This horse has its tongue out, potentially some marks on the tongue there. And then this horse is swelling of the right mandible, and this was an apical tooth root infection in this horse. So part of, you know, we're seeing these problems, and then we are, you know, as a veterinarian, as your dentist, I'm coming out, I'm looking at this. So what I'm doing when I'm coming out to see it is examining the horse, and this isn't just looking in your horse's mouth. We're doing a physical exam, assessing the health of your horse, its body condition, listening to its heart and lungs previous to sedating them. Previous to the intraoral exam, we're doing extraoral exam, looking at the symmetry of the face, any, you know, swelling, atrophy, etc. And then, you know, we move on to our intraoral exam, looking at, you know, the inside of the mouth and tongue, cheeks. Some really important factors would be to improve our examination, especially the intraoral exam, are having really good sedation and adequate restraint, a good speculum and a great light source, and then having a qualified individual performing the exam. The nice thing about being both a dentist and a veterinarian is that oftentimes, you know, I'm assessing the overall situation and not just focusing on the teeth. You know, we may pick up on something that otherwise would be missed. This is just some photographs showing, you know, a horse with a nice speculum on, really good light source. You can see that mouth is really well illuminated, and we have our dental mirror out there, and we're checking all the occlusal surfaces, looking at each individual tooth. Same thing here, just a different view. We've flushed the horse's mouth out and going from there. Here are, in our intraoral exam, these would be common findings. Sharp points, transverse ridges, hooks, steps, ulceration of the tongue or cheek, and young horses retain caps and wolf teeth. And then some more of the uncommon findings would be abnormal bite planes, which would be, you know, wave or step mouth, fractured teeth, excessively worn teeth, periodontal disease. Not necessarily going to see tooth root infection, but there may be an odor from the mouth. You may see swelling on the jaw, and that's something that we assess further with further diagnostics. And then this condition down here, EOTRH, equine odontoclastic tooth resorption hypercementosis, more a geriatric horse disease, but this is something we are seeing more and more commonly. And it mainly affects the incisors, and, you know, we can assess it better with radiographs. So that's kind of where we're heading with our further diagnostics. So the two main ones I think we use the most in related to dentistry are radiography and computed tomography. So CT and X-ray. And in this next picture here is, I believe it was probably the same horse that had the apical tooth root infection. We're radiographing that right mandible to get a better look at that tooth root. And then CT, this is a good way to, you know, you're not only assessing the teeth, but we're looking at the sinuses here and how that affects the teeth and the sinus together. So once we've assessed the issues, we're fixing them. So the equilibration, this is, you know, how often should you get your horse's teeth floated? And this is probably a question I answer almost daily. And I think it's very dependent. In younger horses, you're definitely going to do it more frequently. As we looked at earlier, in that first 5 years of their life, there's so many changes, different teeth erupting. So, you know, requires more often to keep those in check. And then I think, you know, again, later on in life, as horses' teeth are changing, you know, they're really wearing or they're potentially having cracked teeth, whatever, maybe we're increasing dentals again then. But I would say at least annually would be a recommendation. And as far as level of performance, many of these horses at a, you know, higher level of performance were floating their teeth on a more regular basis, let's say, you know, every 6 months, and maybe we're not correcting issues, but we're, you know, attempting to prevent the horse from ever having any discomfort so that they can continue to compete at that level. Yeah, so I mean, again, and this is like, when should you first perform a dental on horses? And I think before you start training, before you're going to start asking a lot of a horse and, you know, get into training, let's look and see what's going on there. Previous to that, and again, it goes back to the other slide, so much is changing within those first 5 years. So good to assess that early and know what you're dealing with the rest of the horse's life. Take-home messages: regular dental exams allow detections of problems sooner, which help to improve the treatment success. And then, you know, having routine dental equilibration or floating keeps your horses comfortable, healthy, and performing well. So thank you. That is my the end of my presentation. I apologize for any technical difficulties and if there was any redundancy there in the presentation. So, and then, okay.
Thank you, Jillian. I see the question. It says, if your horse is adjusted by an equine chiropractic vet monthly, but still has the same areas that are out upon the next adjustment and so forth, what does that mean? And is that typical? Yes, so I like to tell people the first time I adjust a horse, I write down everything that they have out, do all the adjustments, and then I like to see them in 2 weeks. And then at that point, I gauge if there's the same places that are out. I like to keep them at 2 weeks and see if we can make some headway that way. I think the goal is to stretch it to a monthly adjustments, but sometimes horses don't hold the adjustments that long. And you have to make sure that, you know, the dental health is good and the feet are also shod well. But I would start it every 2 weeks and see if some of those problem areas stay at bay for that amount of time. So every once in a while, in rare cases, I'll do it every week. But most of these Grand Prix horses, I'm doing no more than every 2 weeks. And then if they're holding the adjustments well, even with their heavy training, you can go back to 3 weeks, and then next time if they're holding them as well, you can go back to 4 weeks. So I think monthly adjustments is the goal, but isn't always feasible with a horse in full work. So.
Got it. All right. So here is a question from Holly, and I apologize. I think the name is getting cut. But anyways, is grinding of the teeth during riding a dental problem? And I would say it could be related to a dental issue, but I think it could also be related to just general pain and discomfort somewhere else in the horse as well. I think if they potentially are having an issue with the bitting, they could be grinding in their teeth, but I think oftentimes grinding in the teeth could also relate to any other pain or discomfort within the body. Yeah, just slide back.
Okay, so I saw a question up at the top from Jamie Waters. Excellent question. What type of day-to-day therapy type products or stuff can we do to maintain our horses? Her question include ice boots, wrapping, poultice, hoof packs. So those are all great modalities that we have to treat our horses at home to try to prevent inflammation before inflammation gets too severe and turns into an injury. So honestly, Jamie, it depends on your horse and what common problems that your horse is having. Things like soft tissue injuries as well as joint injuries can both benefit from ice boots. Wrapping is helpful to decrease the incidence of swelling in the leg. Poultices are an excellent modality to pull heat out of the leg. And hoof packs would be if your horse had some sort of soreness in the foot. So it really just depends on your horse, and they're all helpful, and they don't really, those types of modalities don't really have any conflicting information or benefit between them. Any other questions, you guys see? Okay, well, we know that we run over on time, and we really appreciate everybody tuning in today for this webinar. I hope it was informative. I hope you learned something about horses and veterinary medicine and how it can pertain to keeping your horse performing well. And if you have questions, we would welcome the opportunity to speak with any of you individually directly by reaching out to Palm Beach Equine Clinic. Our website and our phone number contact information will be as follows, as well as can be found on our website, which is equineclinic.com. Thank you again.
Thank you. Thanks.
Thank you. Great. Well, thank you, Dr. Ryan Lukens, Dr. Marilyn Connor, Dr. Tyler Davis for a very informative session. I know we had some technical difficulties, but thank you all for bearing with us, sticking with us. We know you're all here to learn, and they certainly gave a very informative session. So thank you to the Palm Beach Equine Clinic for your generous sponsorship, and please join us next Thursday at 6 p.m. Eastern Standard Time for WEF Week 3, which that topic will be Breeding the Sport Horse Mare, Challenges and Advanced Reproductive Techniques, sponsored by Spy Coast Farm. Don't forget to register directly on the PBIEC website to secure your spot and to count as one entry for the grand prize giveaway from Karina Brez Jewelry. Thank you all very much. Have a great evening and see you next week. Goodbye.